Live from the SABC's Auckland Park studios, welcome to this Friday edition of the Watchdog. My name is Vuyo Mvoko. There may have been no surge in COVID-19 infections during the election campaign period, and the infection rate may remain low for now. That, however, doesn't mean there might not be a fourth wave on the horizon. We speak to the National Department of Health about the road ahead of the mid-December to January period when the fourth wave is expected to start. And a day after the Minister of Finance delivered his maiden medium-term budget statement, warnings from NGOs that he may have overlooked some danger signs. We speak to one such organization. And we end the show with a view from a well-known South African political commentator, or rather, puppet, offering their view on FW de Klerk, the former president's legacy, and that video we played out with last night. All of that in tonight's episode of The Watchdog, which starts right now. The fourth wave of COVID-19 is expected around late December or early in January. Health Minister Dr. Joe Phaahla says the department has already begun preparations for that wave. However, scientists are yet to detect a variant of concern.
While COVID-19 cases have dropped, South Africans have been cautioned that a fourth wave will hit the country in the next few weeks.
Our national team is working with provincial teams to prepare for the inevitable fourth wave, but we have to do everything possible to make sure that we can delay it and make sure even when it comes, it must have far less impact. The health facilities readiness in preparation for the fourth wave is addressing areas such as availability of oxygen supply, of which our bulk supplier, which is Afrox, has already finalized contingency plans for making sure that when the fourth wave does come, we do have enough supply of oxygen. Other areas such as bed capacity, also equipment, and also such as ventilators and other equipment, the personal protective equipment, and also other consumables, all these are receiving attention to make sure that we'll be ready, which is expected somewhere in the middle of December or late December or even January.
Despite Phahla's confidence of his department's preparations for the inevitable fourth wave, he cites staffing solutions as a challenge.
A major challenge is retention of staff, as many of our additional staff employed for the COVID have been employed on short-term contracts. So this is a major area which we're also discussing with our National Treasury colleagues to make sure that we can receive additional funding to make sure we can retain the staff who are making sure that we can have enough capacity to look after the patients.
And with staffing problems that will hopefully be resolved with the assistance of Treasury, for South Africans intending to travel abroad, Phaahla says there will be negotiations with other countries to accept vaccination certificates.
Countries have to first reach an agreement on recognizing each other's certificates. So because this is still new and developing, even from our side, we had not yet even started to negotiate with many countries because of the fact that we, as we said when we launched the certificate, that it still needed a lot of improvements. So as I mentioned this morning, one of those improvements have already been achieved in terms of activating the safety of the QR code, which can now be scanned and verify information. But there is furthermore security features which will be enhanced during the course of this month. So as those security features get improved, we will be negotiating. We have already also been approached by some countries to recognize their certificates.
The department also raised concerns about the low number of vaccinations in the 18 to 34-year-old age group. Despite this, it's confident that by Monday, 40% of the adult population will have at least received one vaccination dose. Mahlako Komani, SABC News, Johannesburg.
Well, to discuss those issues further, we're now joined by Dr. Leslie Bamford, who is a Chief Director with the National Department of Health. She is also the vaccination team leader. Good evening, Doc. Thanks very much for your time. I think there was a collective sigh of relief as we heard the minister reporting back that there was no surge in cases. And the infection rates remain low.
Good evening and good evening to the viewers. Yes, certainly. Currently, the numbers of cases remain low. There were concerns that we might have super spreader events during the local government elections. That seems not to have happened. We still need to watch carefully. But for now, the numbers of cases do remain low.
One can imagine how anxious you must have been as Team National Health, as politicians were crisscrossing the country, doing their campaigning, and of course the day of the election itself.
Yes, well, I think we would really like to thank and appreciate our IEC colleagues. Certainly the feedback that we received was that at the voting stations themselves, all the correct procedures were followed. So the risk there was relatively low. But of course, we know in the build-up to the local government elections, there were many rallies and other political events where social distancing and other very important non-pharmaceutical interventions were not necessarily followed.
Mm-hmm. But of course, I mean, one would imagine that it would not have been just how well the Independent Electoral Commission managed things, and of course the observations of the non-pharmaceutical interventions by many, if not most, people. One would imagine that vaccination, or the fact that we have a significant number of people vaccinated, would have been a contributing factor as well.
Well, I'm sure that also contributed. As you said in your intro, we will, by the end of the weekend, have reached an important milestone where 40% of adults in South Africa will have received at least one dose of the vaccine. So we are starting to have significant coverage across the population. But of course, that does mean that 3 out of 5 adults remain unprotected. Unvaccinated and unprotected. So we really do continue to urge people to come forward to be vaccinated. It's very encouraging that we have such a low number of cases currently, but we know that a fourth wave is inevitable, and we need to work as hard as possible to make sure that when that fourth wave arrives, as many people as possible, and particularly our most vulnerable people, being those over 50 years and especially those 60 years and older, we want as many of those people to have been vaccinated and to be protected as we go into the fourth wave.
We will talk. I mean, we are going to talk about the weekend and going forward in a short while. But just remind us again, Dr. Bamford, about what the target is for us to feel, or at least begin to feel a lot safer than is the case at the moment.
Well, our target has been to vaccinate 70% of adults by the end of the year, which in practice really means by mid-December. So unfortunately, we're probably not going to reach that target, but we nevertheless need to get as close to that target as possible. I think once 70% of adults are vaccinated, particularly if the coverage is even higher in the older age groups, who we know are most vulnerable, then we would start to feel reassured. But we're certainly not at that stage yet. And so we need to pull out all the stops and try and get as many people as possible vaccinated. So as you correctly indicated, this is a Vuma vaccination weekend. So people are clearly encouraged to vaccinate on any day of the week. But we have had these, this is our second Vuma vaccination week. We really tried to galvanize support for vaccination and also keep as many as possible of our vaccination sites open and operational during over the weekend. So more than 1,000 sites, or around about 1,000 sites will be open tomorrow and approximately 500 sites on Sunday. So people who struggle to access a vaccination site during the week for whatever reason are really strongly encouraged to make use of this opportunity and to vaccinate over the weekend.
Is it every available site that will be open this weekend, or will it be only some?
So it's not every site, but it is a substantial proportion of the sites. Each province has a published list of sites that will be open. Those sites are available on our website, and local radios and provincial and local radio have been very active in letting people know which sites will be open. So we hope that people can access that information. As I mentioned, it is on our website. If people are really struggling, they can also phone our call center to find out where they can access a site.
Of course, I mean, the Deputy President, David Mabuza, has been out and about. He is one of the champions of this Vuma vaccination weekend, and he was in the Eastern Cape today. We're going to just quickly bring our viewers up to speed with what he did there on his visit today. David Mabuza in Gqeberha with the Eastern Cape Premier Oscar Mabuyane.
The vaccination campaign hopes to get things back to normal, encouraging as many people as possible to get the jab ahead of the busy festive season. To date, over 23 million vaccines have been administered across the country. A total of 2,000 social spectators are permitted to gather at various sporting events, concerts and festivals. However, government has raised concern in the dropped number of daily administered vaccines.
For the Eastern Cape province, it says we must increase pace, especially here in Nelson Mandela and the OR Tambo municipalities. We must take vaccines to our people. We must go door to door, come close to where they live.
Provincial government has also urged those involved in the upcoming initiation season to adhere to COVID-19 regulation to mitigate the spread of the virus.
We have almost about 70,000 young boys would want to go through this passage. We would want to go them safe and come back safe. Go there healthy and come back healthy. So that's what we are working for. We're putting every systems in place to ensure that we protect them, we look after them. We put reliance more on the families. It's families that must look after their kids. It's not government. Government can only support.
With the fourth wave anticipated to hit the country mid-December to early January, the health department says the province is fully geared up should the surge hit the province.
We have been also working towards to saying we are going to this festive season. There is going to be a lot of people out in the Amalwandle and all those places. And we have been going out with our communication strategy to say, let us ensure that people are compliant, they keep to the the mask, the sanitization, washing of hands, keeping social distances, and trying to stay away from interaction as much as possible.
The Eastern Cape has fully vaccinated over 1.5 million people in the province. The campaign's next stop will be the Free State Province. Luando Nomoi, SABC News, Gqeberha in the Eastern Cape.
A few issues to pick up on from that inset, Dr. Bamford. One is, have you been able to concerned as you are about the fact that there's been a drop in the number of daily administered vaccines? And one would imagine, of course, that's what the VUMA vaccination weekends, which is tomorrow being the second one, are all about. But have you been able to put a finger on the problem as to why there has been a slow pickup, of vaccination by people, or should we just assume that it is hesitancy?
So we have been very concerned for some time about the fact that demand for vaccination seems to have been dropping, that we are not vaccinating as quickly as we could. So we have vaccines, we have vaccination sites, but not enough people coming forward to be vaccinated. So we think there are a number of reasons for this. Certainly, we understand that sometimes people are hesitant. They might be afraid, uncertain. This is something new. And those people, we just really want to reassure them that the vaccines are safe, they are effective, and we would really encourage them to overcome their perhaps justifiable fears and to come forward and be vaccinated. We also know that there is a lot of misinformation that is circulating, and that is very concerning. If people are anxious and hesitant to come forward because they are not adequately informed or are believing incorrect information. So, for example, there are rumors circulating that the vaccines are dangerous, that they're not safe, and all sorts of untrue misinformation regarding the vaccines. So again, really, we're working hard to provide people with accurate information. Today, a program called Vax Champs was launched, and that really aims to identify or to empower ordinary South Africans to become vaccination champions, people who educate themselves and then empower others through education, discussion, engagement to overcome their fears and to come forward and be vaccinated. Of course, we understand that sometimes there are barriers to vaccination. We have a network of vaccination sites across the whole country, but nevertheless, people do sometimes need to travel to a vaccination site, and people might have difficulty having time off work, having money to travel, etc. So we are working to try and, as far as possible, take the vaccines as close to people as possible and to overcome those barriers. So for example, we are piloting the provision of grocery vouchers. Anyone over 60 years and over who vaccinates during November can receive a 100 Rand grocery voucher. And that's designed really to offset the costs associated with, in some instances, needing to travel to one of our vaccination sites. So our understanding is that there are a range of reasons why people have not been coming forward. Of course, now that numbers are low, there's also complacency. But as we said earlier in this interview, the fourth wave will inevitably arrive. And so now is a good time to prepare and to protect oneself and one's family by getting vaccinated.
Just to pick up on something you reminded me of when you spoke about barriers to vaccination. I'm aware of a couple of sites that were not functioning well in the Eastern Cape. And that's where private providers who actually did well in how they ran their site, which was a privately managed and organized and funded site, had to chip in. How much of that is commonplace across particularly the public health system, where sites you have to rely on, perhaps for big numbers of people, actually don't get to function as efficiently as they are supposed to as a result of the experiences of people there at those sites? People tend to sort of walk away or don't even bother to go. How much of that is a contributor?
Well, I must say, in general, we've had very positive feedback about the vaccination sites, particularly in the early weeks of the vaccine rollout. Many people, insured people with medical aid who don't usually access our public health facilities, visited our public sector vaccination sites, and the vast majority of feedback was extremely positive. I'm sure it is true to say that there must be some sites across the country that are not operating optimally, where there may be problems. I mentioned the Vax Champs, and the third role of the Vax Champs, in addition to educating themselves and empowering people around them, is also to report any problems that are being experienced at any of the vaccination sites. So obviously our provincial and district counterparts are working to make sure that the vaccination sites operate as smoothly as possible, but we will now also be receiving feedback from people who are accessing those services and using that as a further means of monitoring and identifying any problems so that they can be remedied.
Mm-hmm. I think I've seen some of the ads. I don't know whether it was before today's launch of the Vax Champs, but where you had doctors and, professionals, health professionals, sort of taking people through some of the often asked questions about vaccination. But what I wanted to ask you, Talk, as well, is whether hesitancy, misinformation, barriers to vaccination and complacency are together the reasons you were saying earlier that we may not be able to reach that 70% of adults target by December.
So exactly. Those numbers, those factors will combine. We have enough vaccines, as I mentioned earlier, we have enough vaccination sites. And what we're really missing now is people to vaccinate. So the more people who come forward and choose to be vaccinated, the closer we will get to that target of 70%.
Now, given the fact that, the period we're getting into now has all types of festivities which can, end up being super spreader events, your beaches, your festivals, your weddings, and the like. Now, from international experience, when people got to the stage we are in now as a country and then became complacent, and then these activities we're talking about started becoming a commonplace, what has been the experience, that which, as South Africans, we should guard against or really be careful about?
So I think we know that the pattern of this pandemic, it comes in waves. And we can't always predict when the next wave is going to be and how high that wave will be, what the impact of that wave will be. However, we do know that there are certain things we can do to delay the wave and lessen the impact. And those essentially are sticking to the basics that we all now know. It's about wearing masks, sanitizing, social distancing, and avoiding large gatherings. So sticking to the regulations with regards to gatherings. Also simple things like if you are going to be meeting up with friends and family, to as much as possible do that outside where the risks are much lower. So it's really about sticking to the basics and then ensuring that as much of the population as possible is vaccinated. There are other factors such as the emergence of new variants over which we have much less control. And those do have a very major impact on the timing and the impact of a wave. Unfortunately, in most instances, there's not very much that we can do about that. And so we have to concentrate on the things over which we have control, the things that I've talked about, and then, of course, being ready for dealing with the impact of the next wave.
Dr. Bromford, thank you very much for your time this evening. She is the Chief Director with the National Department of Health. She is also the vaccination team leader, talking us through, of course, that report that was given by the Health Minister this morning. Thank goodness we have been able to sail through. We did survive electioneering, election day, and everything that went with that. The numbers remain low. There was no spike at all in the cases. However, we are being warned that around mid-December to January, we may be facing a fourth wave. So let's stop being complacent, because the worst may just hit us if we do indeed become complacent. Well, there was someone who added his voice to the calls for all of us to be vigilant was the president today, who was addressing an economic gathering, or a gathering that was discussing the economy, where he also spoke about the economic benefits of ensuring that we get vaccinated and we do everything in our power to avoid being infected by the virus. Take a listen.
When we are all vaccinated, then our economy gets a boost. Our economy gets a lift. Just like yesterday, when our Minister of Finance delivered the medium-term budget policy statement, it has already started showing very positive signs of a lift. And these are some of the things that we need. So today, as we talk about this Eastern Seaboard project, development project, it is one of those initiatives that is going to give us a lift. And we will be spreading these types of initiatives throughout the country, because it is through economic development that we will be able to address the three challenges our country faces: unemployment, poverty, and inequality. And we'd like to say to the business community, thank you for being here. Thank you for participating in what we've been doing over the past 3 days. We really value your partnership and your participation. We want to promise you that we will not let you down.
So, if you still haven't, please go and vaccinate this weekend. Most sites across the country will be open for you to do exactly that. Time now to take a quick break. When we return, we revisit the Minister of Finance's maiden mid-term budget statement with Zuki Swakota from the Public Service Accountability Monitor. Well, let's welcome for this segment Zuki Swakota, who is the head of monitoring and advocacy at the Public Service Accountability Monitor. Good evening, Zuki. Thanks very much for your time. Now, you guys did release a statement today talking about a few things that you observed and warnings you hope that the minister would heed. But first of all, I mean, for the benefit of our viewers, I'd like to give us just broadly your take on the minister's statement yesterday.
Yeah, good evening, Rio, and good evening to your viewers. Thank you for having us today. I would say that as a sort of brief overview, and this is something that's been said by many other commentators as well, is that in many respects, the minister's medium-term budget that he tabled feels like much of the same, more of the same over the past couple of months. And so in some respects, there have been some disappointments in the budget that he tabled. And certainly there's a lot that we are looking towards in the February budget, given his signaling and given his promises.
Well, I mean, a lot of people say, and they said as much yesterday, that the medium-term budget statement is not really a new budget. It merely gives pointers, you know, to what the government intends or hopes to do, so that there's a context within which we then get to read and experience the February budget. But what specifically were the areas where you felt a huge disappointment?
No, I think to begin with, there's certainly, and our interest is twofold. There is the work that we've been doing in the context of budget justice, as it were, and with other partners within the Budget Justice Coalition, for instance. There's also some of the specific work in which we've looked at what budget decisions, what implications they have for public institutions, particularly those that are responsible for oversight, monitoring, and proactive prevention of corruption and of crime. So in those two areas, there are perhaps two areas that are disheartening. In the context of budget justice and in really looking at the social justice questions that should be answered and or the social justice imperatives that should be met by any minister around the world, in fact, Minister of Finance, or any budget that any treasury around the world tables. The disappointments in our context have been to see certainly in the next 3 years within the medium-term expenditure framework, the continued cuts to key areas, to basic education, to health, and so on. And so while Minister Godongwana did say that in what was tabled yesterday that there were no, at least in the short term, immediate cuts, but certainly looking forward, I think it is disappointing to see that we can expect additional cuts. On the side of public institutions, sorry, yes, go ahead, Rio.
Yeah, I was going so perhaps before we get to
on the public institutions.
Yes.
Sorry.
Perhaps we could go through some of them. Let's start with the very public institutions you're talking about. One of them that you're mentioning is the allocation to the Special Investigating Unit. That is expected to be cut by 134.2 million over the MTEF. And you're making a good point about the fact that they have done, I think, reasonably well over the last while. If you look at the cases they've had to tackle around your PPEs and the like, the information they've been able to come with. I mean, you've seen how the axe has fallen on some very prominent individuals as a result of their actions.
Absolutely. And I'm actually glad you raised that point, Rio, because for most people at home, the kind of level of prominence around some of those, investigations, politically exposed persons have been implicated and charged, or certainly we've seen investigations that are really high impact within the context of PPE. Certainly, again, from the outset, we saw that the presidential, the presidential instructions to the SIU at the very beginning in 2020 indicated that there was much work that they needed to do. And so the investigation capacity, or the capacity of the investigative, staff, needs to be well-resourced. And I think that it is encouraging to see from not just the SIU, from the National Prosecuting Authority as well. What we've seen in recent months has been some, certainly I think, I don't think anyone would disagree with this, that there has been some really important traction, some really important investigative work and reporting to the public, which I think is perhaps another really fundamental aspect. So on that note, the SIU themselves have indicated that at present there are capacity constraints, and this isn't a recent thing; has been over several years. We've also noted that there has been real efforts to procure equipment to support the investigative work, but in addition to that, to really address the issues of staffing and personnel capacity. But the fundamental question is around the extent to which these, this capacitation or capabilities can be sustained and can be increased, and in fact, the momentum built around those investigations. It is likely, as we've seen already, that institutions like the SIU, like the NPA, and related, institutions will need much greater capacity, not only to investigate, corrupt activities after the fact, but in fact, in many respects, to kind of have that capacity to monitor. And I think so. This is why the budget becomes a fundamental instrument to either build that capacity or support that capacity, or in fact be a barrier to sustainability of investigative capacity for those institutions. So it is a concern for us.
And it's interesting to note that on the one hand, you have organizations like your NPAs and your SIUs, that are constrained, because they don't have adequate resources to deal with what most of us agree should be a priority, dealing with, corruption and mismanagement. And on the other, you have, I wouldn't say they are cash flush necessarily, but you have increases in the amounts allocated to such entities as your ESCOMs, who of course use the fact that they are so central to our lives, to our economy, and all of that. But there is no prudence, across the board in how they use those monies. I mean, I think it was the day before yesterday, auditors who appeared before Parliament were warning that what we thought ended with the 9 wasted years people have been talking about actually continues in as far as the management of contracts is concerned. People saying they're seeing the auditors saying there are similar patterns with in the management of new contracts as there were with previous contracts, which should alarm all of us, because there we are thinking, these entities have started on a new leaf. if, all the things that they were notorious for in the past have actually been dealt with, and the problems we're dealing with now are new problems, or still trying to fix, the old problems. It turns out, I mean, the sins of yesterday are still the sins of today.
Absolutely. And I think, in fact, the minister's own acknowledgement in his budget speech around the billions of rands, he stated from 2013, but of course we can go, further back, that have been spent in bailouts to state-owned entities, and Eskom, of course, being one of those, and how those trade-offs have a direct trade-off on the one hand, or direct impact on social spending. But in fact, we do also need to think about what that means for the ability for the state to boost and shore up its capacity to do investigations, but also to have proactive mechanisms to preempt corruption and to address systemic flaws before the fact. I think very often it is about, the audits are very important, real, but at the same time, there's investigations and audits after the fact, the money is gone, and so recouping the cost is an entirely, different animal. And on, what you raise about, the fruitless and wasteful expenditure, as there was the tabling of the budget recommendations, budget reports and recommendations in Parliament, and the Auditor General's office indicated just how worried we should be as a nation about, Eskom in particular, and their inefficient procurement practices, poor contract management and overpayments. So an entity like that, and we are seeing, as we speak, continued, exactly as you said, continued maladministration. And so on the one hand, those are really worrying trends, and it's again why we say it's much of the same. And if the state isn't making real directed and concerted efforts to resource capacity in that regard, preemptive anti-corruption capacity, then we'll be talking about this for many years to come. What is encouraging in what Minister Godongwana said was about how, the intention, and again, it's an intention at this rate, and perhaps we'll come back to the February budget and have a closer look. But the intention for some of the windfall, I think this word has been used, and I'm not sure windfall is the accurate word, but it's a word that's been used. But the intention to use some of the windfall over, from the current financial year towards, capacitating anti-corruption sort of interventions within institutions. And I think that's actually really important. So that was an encouraging acknowledgement, again, about the importance of anti-corruption interventions, but again, of the impact of corruption within the state. And the SOEs really do continue to be a major drain on the state in this regard.
Well, speaking of encouraging things he said, and your very last point about SOEs, did you find any solace in him saying it's about time, we focus on SOEs that are strategic to the economy and really do away with those that don't bring any real value to us or to the economy?
I mean, I suppose that certainly is one of those statements or those sentiments that is, deserves some closer interrogation. I do think that there was a lot of, I suppose it, being a politician, there is much in the speech that speaks to people's anger and seeks to, reassure people. But I think we are at this point, there isn't enough in what we've heard and what we've seen to reassure us that there is change coming. I mean, another point is around the draft, public procurement bill. As we know, procurement is another, just major source of loss for the state and a major source of corruption. And what we've seen at this point is, again, a sort of stagnation in the processing of a really important bill. We did hear that the minister said that the National Treasury is reaching the final stages of finalizing the bill. What we would hope in that instance, and as you likely will be aware, there were multitudes of submissions made from civil society, from business, and from a range of others on really how to reform procurement, that it is on the one hand efficient, but also for civil society activists, I think it's really important to have a state procurement system that is just, that is fair, and ultimately really contributes to the developmental project that the country needs to be really fast working towards. So on the one hand, there is much that is kind of political promise that was contained in the budget speech. But when we took a look at the numbers, you know, I think there isn't at this point enough to give us reassurance and solace that there is adequate transformation and adequate reform in each of the areas that are of concern.
And that's where we're going to leave it for tonight. Thanks very much for your time this evening, Zukiswa Akota, who is the head of monitoring and advocacy at the Public Service Accountability Monitor.
Hey, I wasn't going to say anything about de Klerk myself because my sidekick Conrad already said something on my Facebook page. But quite frankly, if he's going to drop last-minute videos after he's dead, like he's freaking Prince, well then screw him. And before you start on something about respecting the dead, if de Klerk respected the dead, he would have told us what happened to the Craddock 4 activists. He would have spilled the beans at the TRC. But no, de Klerk respected the dead like Eskom respects your workday. Now people are saying that he apologized for apartheid. No.
Well, the FW de Klerk Foundation yesterday put out a final message of the former president where FW de Klerk apologized for the role he played in the country's painful past. Now, there's been mixed reaction to the apology. Satirist and comedian Chester Missing was not left out of that conversation. But first, take a brief look at what FW de Klerk said in that last message that his foundation recorded and released yesterday.
This is my last message addressed to the people of South Africa. To my dear wife and family, I will say goodbye in a different way. Our country faces so many challenges of a serious nature. I hold firm opinions about all of them, but decided to keep this message very short and only really focus on two issues, touching me and touching the country. Before I do so, I would like to thank all my friends and supporters for the wonderful support and encouragement they gave me throughout my life and throughout my political career. Many of them were close to me, even for decades. Others intervened occasionally. I thank you for your support and your trust in me. I thank you for your friendship. Thank you for having carried me on your shoulders for so many years. The first issue I want to focus on is apartheid and me. I'm still often accused by critics that I in some way or another continue to justify apartheid or separate development, as we later prefer to call it. It is true that in my younger years, I defended separate development, as I never liked the word apartheid. I did so when I was a member of parliament, and I did so as I became...
Well, here's Chester Missing's take on that video.
Hey, I wasn't going to say anything about de Klerk myself because my sidekick Conrad already said something on my Facebook page. But quite frankly, if he's going to drop last-minute videos after he's dead, like he's freaking Prince, well then screw him. And before you start on something about respecting the dead. If de Klerk respected the dead, he would have told us what happened to the Cradock 4 activists. He would have spilled the beans at the TRC. But no, de Klerk respected the dead like Eskom respects your workday. Now people are saying that he apologized for apartheid. No, he didn't. He's choosing his words very, very carefully.
I, without qualification, apologize for the pain and the hurt and the indignity and the damage that apartheid has done to black, brown, and Indians.
He apologized for the pain. It sounds the same, but it's not. If I stab you and then apologize for the bleeding, that's not an apology. You have to say, I'm sorry that I stabbed you. He's just letting himself off the hook again. De Klerk was apartheid's divorce lawyer. Today, white South Africans are on average 6 times wealthier than black people. 6 out of 10 senior managers in South Africa are still white. If you want to make it in your career, there's probably a white guy involved deciding how well you do. 187 of the top 200 schools in South Africa are still in previously white areas, and the main negotiator of this status quo was de Klerk. That's why he waffled on about the Constitution.
And I'm deeply concerned about the undermining of many aspects of the Constitution.
Because he blocked actual recourse for apartheid's pain every step of the way. This dude thought affirmative action was unconstitutional, even though he headed up the biggest affirmative action campaign for white people in human history. What did he do to fix the damage? That was the apartheid that needed fixing. Instead of spending his life helping white people understand how they benefited from this, he avoided it, like a broke guy dodging blocked numbers at the end of the month. It wasn't me. I'm not Jay. He's not available. I'm sorry. We're breaking up. Beep, boop, 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 boop. As Ankie Kroch writes, he had a moment at the TRC to take moral leadership for white people, and he dropped that ball so hard he could be a Proteas cricket player. He's a bit of a de Kock. No. You and your video.
Just a missing. And that was our show for this evening. To have a good night and a great weekend.